I'm Samantha Burford for WBONTV.com. We're at the Madison County Extension Office learning all about drug prevention right here in Madison County. We talked to lots of the speakers today to learn about future planning for our students in Madison County.
First Trust Bank has a brand new state-of-the-art facility here in Richmond. Stop in and ask about the products and services they offer. First Trust Bank is known for hometown people and hometown service. Member FDIC, equal housing lender, and MLS number 688788.
Give us an idea about what has happened here today at this celebrating drug prevention here in Madison County and the effects of what it's doing here in Madison County.
Well, I'm very excited how much it's grown, and you're getting community partners, business leaders involved in the strategies of what we're trying to accomplish. So this meeting today, I was overwhelmed at the number of people that's here and supporting our efforts in the drug prevention effort. Just amazed of all the stakeholders here, all the elected officials that support the efforts and financially are trying to help all of us trying to accomplish the same goal. We're all in this together.
So one of the really important tools we have for people with opiate use disorder are medications. And what some of these medications do is allow a person to begin to enter recovery and enter the healing process. And the reason with opiate use disorder that this is so important is that either due to heredity or due to trauma in their lives or due to the changes chronic opiate uses create in a person, their neurochemistry in their brains mean that they spend almost every day, all day, trying not to use. And that's that we call that craving. And so because relapse rates are so high, we have powerful tools now, including some medications, that will help that individual benefit from other forms of treatment like counseling by sitting on those receptors in the brain, diminishing that craving, allowing them to think rationally. And there's a subset of individuals where taking those medications on a long-term basis are going to be necessary. So I'm talking about medicines like methadone or buprenorphine. And those medicines can allow a person to be functional, get a job, raise their kids, pay taxes, and if it's working for them and they're in recovery, we need to understand that's appropriate, not shame them, not say that you're trading one drug for another, not saying that you're not in recovery, you're still an addict. Those folks are getting appropriate treatment for opiate use disorder, and in my opinion, they're in recovery, and we need to support and understand that.
What kids told us in the surveys is that they have pretty easy access to alcohol, either at the homes of their friends or at their own homes. And because everyone's focused on alcohol, sometimes, or on opiates, sometimes alcohol doesn't get the attention that it deserves. And so a lot of people think, well, this isn't as bad as opiates. And so we just want to help adults understand what's going on in teenagers' brains during this period and how alcohol during this time can actually be really harmful for the developing brain, more so even than alcohol use in adulthood.
So if someone wants to be on this team and find out more information, what do they need to do?
Call the Madison County Health Department, 859-228-2044, and ask for Laura.
I'm really a clinician who is experienced in seeing children and adults with behavioral health disorders as well as pediatric primary care. But I moved to Frankfurt 10 years ago, and it's been a lesson. But the one thing I've learned is that this substance use disorder epidemic is ravaging our state, and that it's really now, I think, our #1 public health issue.
If you need help or know someone that needs help, go to findhelpnowky.org. I'm Samantha Burford for WBONTV.com.